morning, good afternoon, good evening, depending on where you're watching from. Again, this is Dr. Masi Mutahi, and I'm here to tell you about preventative measures. In this channel, we talked about how we're going to prevent ourselves from common ailments or common diseases that we usually get, and what can we do to prevent or to decrease the healthcare costs, because healthcare cost is quite on the rise, and if we don't do something about it, it's going to continue increasing. So that's why Dr. Masi Mutahi's channel is all about preventative healthcare journey. So I've been bringing you, as usual, I've been bringing you Alan Hoe, who we have been discussing on common diseases or ailments and how to prevent them. I'm going to bring on board other doctors to help you manage or to help you prevent ailment or diseases. Now, today, we're going to rush on the most Googled common conditions. And number one, pneumonia. Let's talk about pneumonia. Pneumonia has been one of the first or the common Googled disease. And pneumonia, it's a lung infection caused by streptococcal a bacteria known as streptococci, and these bacteria you can get them from either the upper or any infection involving the upper airway, that is from the nostril to all the way to the lungs, from the nostril where we inhale from. So what can we do to prevent pneumonia? Because pneumonia, it's not brought about by majibaridi, or it's not brought by what else have I had? Myths. I've had myths about pneumonia, and I've heard that when you take cold soda, you'll get pneumonia. When you get rained on, you'll get pneumonia. No, it's not brought about by all those things. It's brought by dirt in the air. That is bacteria in the air, whereby we inhale them, and we end up getting the streptococcus in the lungs, which multiply, and then it gives us pneumonia, which basically is inflammation of the lung, mucosa of the lungs. So what can we do to prevent pneumonia? Ensuring that, one, we aerate where we are living. I have seen most of the time when you go visiting somewhere, you always make like their windows are usually closed, or the carpet, you don't even know when you wash the carpet last, how the kitchen is, and the type of gas you're using, or the type of fuel you're using to cook. All those, if we do not aerate the room, we leave those bacteria to multiply for quite some time. So what can we do to ensure that our kids are not having these recurrent pneumonias? It's ensuring that the air they are breathing in is well aerated, it's well oxygenated. And how are we going to ensure that? Ensure that you open the windows, ensure that the room is dusted, ensure that the carpet that you're using is also dry enough and it's also clean, and also the blankets you're using to cover yourselves, ensure that they are clean, well clean enough. It's good to change maybe the blankets weekly or 2 weekly, depending on your house, how well you maintain your hygiene in the house. Okay. And number two most Googled condition was TB. In Dr. Alan Hoe channel, you'll find us discussing more on TB, but I'm going to highlight how we can prevent ourselves from getting TB. Remember, we can get TB and it remains in our body for quite some time without it being active. That is, it stays in latent stage, meaning that we are not symptomatic, or we are not exhibiting any symptoms, and we are also not infecting other people. But when it becomes active, the bacteria bacteria multiplies enough and it becomes active, we can be able to infect other people. And we always say, if you're not infected, you are affected. So ensure that you tell your neighbors, you tell your friends, you tell your family on this channel so that we are able to prevent more and more diseases. So about TB prevention, how do we make sure we prevent TB? It's always good to maintain a distance when you are in a room, or you are in a meeting, or you are in any facility you are in, or you are walking. Maintain that distance. Ensure that while coughing, because it's how you get TB is through inhaling the droplets that have active bacteria of TB. So ensure that you maintain the distance, cough while holding your mouth. Also, another thing is ensure that also the room is aerated well enough. Number 3 common Googled condition was tonsillitis. Tonsillitis is not caused by taking sugar or ingesting sugars or taking cold drinks. Also, it's caused by something we call bacteria, also strep bacteria, that are commonly found either along the mouth or around the mouth, whereby once you don't maintain the oral hygiene, you can get tonsils. As we said, when we take sugar, it only contribute to contribute to bacteria having or multiplying the bacteria that are already there. So what do we do when we take sugar so that the bacteria cannot multiply? We brush our teeth. It's good to at least maintain oral hygiene once per day. Ensure that you brush at least once per day, or you can brush as many times as you want, but at least once per day. Ensure that you drink plenty of water, that is after meals, so that you can remove the debris that remain and cause tonsilids. Tonsilids are stones. There are stones around the tonsil region. They are the one I'm calling tonsilids. So ensure that you drink water so that all the debris that remains around the mouth or along the tonsils, they get swallowed. So another common Google condition was bacterial infection. I know that most people, when you go to the hospitals or to the clinics or to anywhere that you go, and maybe the doctor tells you that you have bacterial infection, and you wonder, what is this bacterial infection? Yeah. So it's a common language that people use when mostly they are not able to find the real cause of what you are suffering from, and I've seen most of the hospitals or clinic using that much. So this is what happens. When they do a full hemogram and they find either the full hemogram is a lab work that they get a blood sample, they withdraw a blood sample from you, and then they run it through the machine, and then you'll be shown figures going, or you'll be shown figures on that white sheet paper, and they will tell you that either you have a bacterial infection or such. Now, this is what happens when the WBCs, those are the ascaris in the body, or our defense force in our body that fights diseases, they rise too much, or they increase too much because they are fighting an infection. Either they can be fighting a viral infection, they can be fighting a parasitic infection, or they can be fighting the bacteria, or they can be fighting an allergy. So this is what usually happens when you have any infection. May it be a flu, it's going to cause an increase in those defense forces. Or if you have maybe a UTI, or you have a GI, flu of the stomach, or you have stomach issues, you have respiratory issues, it's going to cause an increase in those WBC. So when you are told about bacterial infection, it's good to ask further, which bacteria am I suffering from? Remember, it's your right to get to know the cause of what you are ailing or the cause of which you are exhibiting signs and symptoms from. So when you go to a doctor, you usually explain how you're feeling and the doctor examines you. So how you're feeling, it's a symptom. I am having a headache, I am having a tummy ache, I'm having joint pains. Those are symptoms. Now the doctor will again go further and do a physical finding whereby a doctor will tell you you have a fever, or they will take your temperature and they will tell you have a fever, you are swollen, your tonsils are swollen. Now those are signs. Now everything, whether it's a bacterial infection that you've been told, has signs and symptoms. So ensure that when this doctor tells you, your healthcare provider tells you that you are suffering from bacterial infection, ask, where is this bacterial infection coming from? Because I'm definitely sure you do not want to start taking antibiotics which you do not know what they are treating. So, and I'm not saying this because I am telling the healthcare providers that you are going to run out of business. I'm telling you this because I know something called drug resistance. All these antibiotics we give, all these medications we give, they can bring about something we call drug resistance. And when they bring about those drug resistance, once you get now the actual infection, you'll have to go an extra cost to cover something you could have treated with a lesser cost. And what are we all about? Preventative measures. So anything you ingest, you have to make sure this doctor has defined why you are taking this, and these are the signs. According to these signs and symptoms, according to my physical finding, according to the lab work, according to the imaging, this is what I have found in you that is causing this I am calling bacterial infection. Okay. Another common Googled condition was UTI. In our previous session or in our previous videos, we have discussed UTIs, we have discussed including the common forgotten UTI or the most common forgotten diseases. We have discussed them, including honeymoon cystitis. We have also discussed STDs. So ensure you peruse through my videos to get to know what I'm talking about and how you can prevent the UTIs, the STDs, all those things you can be able to prevent. Another one that is commonly Googled is mental health. And mental health, 2 days ago, we discussed mental health. And mental health condition, when we were discussing it, we ensured that we are giving you the causes and how to maintain it. And how to prevent it, And we are all about preventative measures and promotion of good health-seeking behavior so that you can be able to prevent these diseases. So let me know in the comment section below which conditions you like me to discuss about. Is it the most common Googled, other most common Googled? As I have talked about them, we have talked about pneumonia, tonsillitis, TB, and we have also talked about bacterial infection, UTI, and STD. So let me know in the comment section what you'll want me to discuss vividly, because I'm going to bring it to you and I'm going to show you how you can cut healthcare costs by 90%. I'm assuring you the results because I know as healthcare providers, if we do not talk about preventative measures, we are going to result in too much burden of healthcare. And as healthcare providers, let's always practice what is called health education and health promotion of good health-seeking behaviors. And as for you listeners who are listening to us, ensure that you follow us for more tips. You subscribe to our channel so that we can continue giving you more and more preventative measures, and we can continue bringing you more and more healthcare providers to ensure that you're getting the best and the best from it all. And also ensure that you click that notification button so that when I'm uploading any video, you'll be the first to be notified that I have uploaded a video and get to the comment section. Comment, because we need more comments so that we keep being motivated to keep uploading this video. Next, I'll be bringing you doctors from different health, but you can make my work easier by commenting down below which doctor you'd like, or which specialty of doctor you would like, and how we can be able to make sure that we prevent ourselves. Okay, for now, keep it tuned at Dr. Mercy Mutahi in all channels, and remember, mobile doctor _ Kenya, a Kenyan WhatsApp channel that you can be able to follow, and you can be able to keep yourself updated on any health journal or any preventative measures. Keep it locked. Thank you and good day to you all. This is Dr. Mercy Mutahi. Bye bye.